So Charlie, when I see nurses out and about as part of my daily job, quite often I'll ask about wound preparation and debridement, and different nurses will have different practices when it comes to cleansing and debridement of the wounds that they see. What do you think are the challenges when it comes to promoting cleansing and debridement, and why do you think that some clinicians are reluctant to do that?
Maybe it's a slightly taboo subject in wound care. Lots of healthcare professionals, whether they're registered or not, don't think that they are able to do wound preparation, including cleansing and debridement, because they see debridement as somebody using sharp debridement or conservative sharp debridement and cutting away that devitalised tissue, when in actual fact, by applying a dressing, we're helping with that debridement process. By using mechanical debridement aids or enzymatic debridement, which anybody can apply or use, we're all doing wound preparation and cleansing and debridement. So I think there's a little bit of a stigma maybe around wound preparation, cleansing and debridement as to who can do it. I think there are lots of myths around whether you should or shouldn't prepare a wound. There's certainly been several things I've heard over my career around not touching a wound bed if there's granulation tissue in it, because you don't want to disrupt that granulation tissue. When we remove dressings, it drops that wound temperature, so cleansing that wound further would drop that temperature even further. Not to touch the wound bed at all, just cleanse the wound edge and the peri-wound skin. And these are all myths.
And if you don't prepare a wound and then you apply a treatment on top of that wound, it's almost not removing that barrier to wound healing. So you could be applying a treatment where you would have almost like a piece of cling film in the wound, and it protecting the bacteria underneath there, and the biofilm that's underneath the wound. So we know much more about biofilms and the positive impact on wound preparation through research over the last few years. And we know how important it is when it comes to wound healing rates to be able to disrupt any biofilm in the wound and to be able to give that wound the optimal chance to heal. We also know that all hard to heal wounds will have a biofilm form within 24 hours. So it's really important to be able to manage biofilms and to cleanse and debride, ready for treatment.
Absolutely. And I think it's really important that whenever a healthcare professional is seeing their patient, changing their wound dressing, doing their assessment, that they need to be preparing that wound. And I would argue at every dressing change, that wound needs to be prepared, because biofilms do regenerate within a 24-hour period. And if we're only changing that dressing twice a week, we need to try and remove those biofilms, those barriers to healing, to help the dressing that we select do the job that we need it to do.